Moving on now to one of the topical issues that all South Africans really have been talking about on the eve of the arrival of vaccinations. What are the logistics of transporting and preserving the integrity of the vaccines once it actually does reach the African continent? The temperatures we've been told and we've heard needed for preservation of these vaccines vary depending on what brand they are. And in some cases, they need to go well below 0 degrees Celsius. If this is not so, the vaccine will break down and become unusable by the time it reaches the patient's arm. So this distribution might be easier for countries perhaps like Europe or the United States, but it may be a mammoth logistical challenge for the African continent. To discuss this further, I'm joined by Atisha Singh, who is the product manager at Lebotech. A very good afternoon to you, Atisha. A very important issue here because, you know, when the vaccines are being tested, ultimately they need to reach their final destination in the very same form that they left the laboratory, still having maintained their potency as well as their efficacy. But talk to us about the different modes of preservation that are needed for different vaccines.
So there are different vaccines that's currently available for the COVID-19 disease. So the first one is the Pfizer vaccine. The Pfizer vaccine needs to be stored at minus 70 degrees. And this vaccine cannot be out of minus 70 degrees more than 4 times. The next vaccine is the Moderna vaccine, which requires less stricter conditions, and storage needs to be at minus 20 degrees. Then we have the AstraZeneca vaccine. Now, this is the vaccine that South Africa is soon receiving, and this vaccine needs to be stored at a fridge temperature of 2 to 8 degrees. We also have the Chinese and the Russian vaccine, which will also soon be approved, and that also requires fridge temperature storage conditions.
So what should happen then if these temperatures are not maintained during the transportation process?
So if temperature of these vaccines are not maintained, what happens is that this vaccine then becomes unsafe as it breaks down. Should the vaccine then be administered into a patient, it basically will not work, and it can lead to potential health risks to the patient getting the vaccine. Also, if you are going to get a vaccine and it doesn't work, you would not have immunity to the vaccine.
And talk to us about the logistics of the travel. How many times do vaccines actually need to be transported before they actually get to the recipient?
So when the vaccine arrives, either via air, then from the airport, it then needs to be transported to a storage site. From the storage site, it then needs to be go to the various different locations in terms of different regions. From the regions, each region will have a storage site, and from there, it then needs to be transported to the various clinics and the various surgeries or doctor sites and hospitals where it will then be administered. From the time it leaves the aircraft till the time it reaches the end point to the patient, that time needs to be controlled in a cold chain process.
And let's talk about the logistics and the challenges that the African continent might have in this. There's a lot of transportation that needs to happen, and one needs to make sure that the infrastructure for transportation is actually sound. Places like the United States and Europe that are quite well developed will probably not have a problem with this. But where do we stand as the continent?
So for this reason, South Africa chose to go with the vaccine, the AstraZeneca vaccine, where the storage conditions are not as strict as the Pfizer vaccine. So with the AstraZeneca one, we can use cool boxes from the time from the plane to the site of where it will be administered, and then be stored in a fridge. And also with regards to the South African temperatures and the African temperatures, it's quite hot, and during transport, there can be changes in temperatures. And there's also transport issues within the African continents. So for this reason, it's more viable to go with the AstraZeneca vaccine.
And what other storage solutions may there be?
For the AstraZeneca vaccine or generally?
Generally.
So currently now, different vaccines have different storage conditions, but because of the COVID vaccines, each vaccine has a different storage condition. So for South Africa, currently now, there are a few laboratories where they can store it. And both available publicly and privately. So we can choose to store the vaccines there currently. If these vaccines reach capacity and there's no storage available because we are receiving a high amount into the country, then we can then look at importing them. The company I work for is Labotech, and we are scientific distributors of laboratory equipment. We then liaise with our overseas manufacturers, and we import these medical fridges and freezers for use for storage of these vaccines.
Well, thank you so much, Atisha, for that. That's Atisha Singh, Product Manager at Labotech. And once you start talking about, more complicated ways of storage, that obviously also increases the budget that's needed for procurement, because now you're not only talking about acquiring the vaccine itself, but you also have to consider the storage needs of that particular vaccine. So AstraZeneca there, as Atisha highlighted, being the vaccine of choice for the South African government for reasons noted earlier.